Good morning, everyone. We're going to talk about common things that we see in kids, kids that present to our office about the age of 10 till about 15 to 16 years old. Now, two very typical complaints are the kid has heel pain or the kid has a big lump on the side of the foot that is very painful after activity. Now, there's also the age when kids starts being more active in sports, such as basketball, karate, barefoot, or soccer, running, etc. This is a time when we tend to see this most often. Let's go over the most common one. Most common one is called Sever's disease. Sever's disease is another name for calcaneal apophysitis, which is just inflammation of the growth plate in the heel. And the second most common thing we see in the foot when the parent complained about side of the foot bulging and pain and swelling on the side of the foot. That's called OsVesalium Syndrome. Both are growth plate inflammation and an area where ligaments or tendons attach to the bone itself. At this age, as you know, that's when growth spurts happen. That's when the kid's more active in activities, and that's when the tendons, the ligaments, the muscle, and the bone grows. The growth plate, the growth center, is where this cartilage turns into adult bone. And sometimes if there's a muscular imbalance or a tendinous imbalance, tug of war between the tendons and ligaments, that's when you get this inflammation of the growth plate. Again, the two most common places are the heel as well as the what we call the OsVesalium, which is the fifth metatarsal base on the side of the foot. I'll point them out in this foot model here. This is where the heel pain usually is, called Sever's disease. And this is where the OsVesalium is on the side of the foot. I'm going to try to show it this way. It's on the side of the foot right here. I'll show you an X-ray of an actual patient later on. But this is what it looks like right here. So typically when a patient comes in about that age group, more than likely it is the Sever's disease. An X-ray is taken for the heel pain. An X-ray is taken and we see this line in here on the X-ray. Now it can look like a fracture, but at this age, fracture of there is very unlikely. Most of the time, I put my finger right along this path, and that's where we see the inflammation, and that inflammation is called Sever's disease. Typical treatment for that, very simple. Heel cup. Heel cup can relieve 80% of the pain for these patients. They, put them in the heel cups and good sneakers. They walk out very happy and relieved. But the long-term care for this is the anti-inflammatories, ice, rest, and stretching exercises with physical therapy. Stretching exercises equals like stretching the Achilles tendon. Watch my video about stretching your Achilles tendon for even adult heel pain. Now we go to the OsVesalium Syndrome, something a little bit less common, but it does happen in this age group also. This is this area right here. Parents will a lot of time complain about a bulge on the side of the patient's side of the child's foot, painful shoe wear. Again, you put ice on this. There's a tendon that attaches from the ankle into this bone, causing a little pull in this area. So a lot of time, patient may have a flat feet. Sometimes patients are just very active. They're playing barefoot sports such as karate or doing basketball. They're constantly pounding this area. That's a normal part of the anatomy, but when this gets inflamed, you get this big swelling right there. Treatment for that equals ice, stretching, the same stretches we do for the Achilles and the heel pain for the Severs. But physical therapy modalities where we stretch out the peroneal tendons, the tendon that goes around the ankle and into this bone right here. That's very important to stretch out also. But also addressing the biomechanical reason for why this patient has this pain, such as if a patient has flat foot and orthotic with a little padding around this bone, will help out significantly for a child. So this is not as easy as just putting a heel cup as it is when we're dealing with Sever's disease in the heel. This will require more physical therapy and stretching of other muscle groups besides just the Achilles and the bottom of the foot. But both of these are very treatable if we catch it early. If we catch it later, the patient takes longer to heal. And very rare cases are surgery ever done for these two conditions. Now, for the Sever's disease, the heel pain here, in my 9 years of practice on my own, I would say only 2 patients require this surgery in all the patients I've seen, because the Achilles tendon right here, or the gastrocnemius complex, is very tight. Physical therapy traction devices did not work for the patient. So go ahead, I have to lengthen this Achilles tendon or the gastrocnemius tendon that attaches to the heel bone where it causes the pull. As again, it's not very common, but can be done for people with resistant Sever's disease. Now, the OsVesalium Syndrome, again, is very uncommon to do surgery for. This patient usually heal without surgical intervention. I'm happy to report that we have not had to do surgery on these, but if we had to do surgery, the surgery would be to go in and if the child is about 15 or 16 more with a closer skeletal maturity, we could go in there and take that little piece of bone at the end out, leaving the cartilage intact. So that's the treatment protocol for that in very severe cases. Most of these can be treated biomechanically with proper shoe wear, orthotics, and good physical therapy and modification of activity. Patients that career in basketball and karate or other severe weight-bearing sports are not going to be hindered in the long run. Just proper treatment is needed at this time to get over this acute episode. So please subscribe to my channel. Check out our Facebook page, FamilyFootAndLegCenter.com. On NaplesPodiatrist.com is our main website. We do have a Facebook page. Please like that. We'll try to keep you up to date. Try to get a conversation going on there also. Your questions and comments are very much appreciated. So anything else you want to hear, please let me know. This is a classic example of OsVesalium Syndrome. There's an x-ray of a patient. You look at her left and right foot. I circled it for you and marked it. That's where it's very swollen on the side of that foot right there. The right is obviously worse than the left, looking at the swelling. Patient was brought in by the mother. We treated with some physical therapy, rest, ice, elevation, and compression. The patient should do very well with such. Any questions, please feel free to check out our website and subscribe to our channel. Thank you.